Good evening, everyone, and welcome to CancerBuddy Conversations. And I'm excited to introduce tonight Hollye Jacobs. And she is a resilience coach and a nurse, social worker, and also a New York Times bestselling author. And she also helps at the Bone Marrow and Cancer Foundation, and she is one of our valuable counselors there with our patients in our clinical care counseling program. So let me find Hollye. Let me see where she is. She's not, I don't see her yet. She should be on in a minute. And so we just have to give it a second. Okay, I don't see her quite yet. So we'll just hold on till she joins us, and hopefully she'll not have a trouble finding us. Okay. Don't quite see her yet. So we'll just give it a minute. Okay, let me see if I can find Hollye. Let's see where she is. We'll just give it a second. Okay, I might have to give her a text to see if she's having trouble. Let me see here. Okay, let's see if we can find her now. I just texted with her. So we'll give it another minute. Let me see. Hollye. I'm having trouble finding Hollye. So just give us a second. Technology. Let me see. Hollye. Oh, there she is. Invite. It should be joining us in a minute now.
Hi!
There you are. There you are.
We did it. We did it. Oh,
Great.
this
Okay. These are always
is my first. It's very
okay.
exciting.
Good. Well, welcome. Well, I already introduced you to the folks that are on already on Instagram, but I'll give a little introduction again for those who have just joined us. And this is Hollye, everyone, a very dear friend of mine, as well as an incredible resilience coach and nurse and social worker and a New York Times bestselling author. And she's involved in the Bone Marrow and Cancer Foundation with our program, Clinical Care Counseling, and is a wonderful counselor with our patients on that program. So welcome, Hollye.
Thank you. Thank you. It's great to be here. Can you see me or is my chin cut
A
off?
little cut off. You could
Okay,
lower
hold
your
on.
camera a little bit or sit on a cushion.
That's what I'm going to do. I'm sitting on a cushion.
Okay.
Let's see. Oh, that's a little better.
Okay, great.
Okay, there.
Okay, now we get the full Hollye.
It's called resilience. What do you do in the face of adversity?
Exactly. So, welcome to our Cancer Buddy Conversation live tonight on Instagram, and to talk about resiliency and cancer and what it takes to get through a diagnosis and treatment and survivorship. And I would love to hear a little bit about your personal story so we can share that with everybody that's on this evening.
Sure. Happy to. So I was diagnosed with breast cancer in 2010. Wow, it's a long time now. And although it's funny, it feels like it was yesterday. And it came out of left field. I was 39, a young mother. I was vegan eating, marathon running, um, no family history of breast cancer when I was diagnosed. And it came as an absolute, complete, and total shock. Very suddenly, I found myself moving from the side of the bed as a healthcare professional now into the bed as a patient. And in my healthcare training, I had been taught how to heal. And then when I got into the bed, that healing became very, very personal.
Mm-hmm. And was that difficult to start to kind of use your own knowledge and professionalism to try to help yourself, trying to get out of, a very dark time in your life?
Mm-hmm. It's interesting because I used my professional experience as very much of a coping mechanism. In
Mm-hmm.
other words, I put on my virtual scrubs and sort of went to work. I had the great benefit. One of the silver linings of my experience was that I had all this professional experience. So I knew what questions to ask. I knew how to assemble a team of healthcare providers. I knew a lot of the things that people who are newly diagnosed simply don't know because it's a foreign world. But for me, it was my world. So it was certainly challenging, but it was such a huge benefit that I had all of this clinical
Mm-hmm.
experience.
Yeah, you had the knowledge to kind of navigate yourself through that initial kind of logistics of cancer and, getting to the right centers. And a lot of patients and people that are facing cancer don't have that knowledge. So they're thrown into, uncertainty and the unknown.
Mhm.
And just to kind of place that with the Bone Marrow and Cancer Foundation, we have a program called Patient Navigation, and we really try to help patients navigate that part of an initial diagnosis and get to the right treatment centers and the right, specialist to get the best treatment.
And that
And
is so important. That initial navigation is it's the beginning of everything. And
mhm,
so I can't overstate how important that is. One thing that so many people don't realize is that they're putting together their team. A lot of times I
mhm,
was working with a woman the other day and she said, well, I was assigned to this doctor. And I was like, no,
yeah,
you're the client,
yeah,
if you will. I mean, you reframe it like that. It's the analogy, the metaphor I use is it's kind of like building a
mhm,
house.
mhm,
You're going to interview an architect or a builder. You're not going to just take someone who says, oh, this is going to be your builder.
yeah,
No, of course not. And so I'll give you an example. One thing that was very important to me from the outset was including palliative care on
mhm,
my team. Palliative care, for people who don't know, specialize in pain and symptom management.
mhm,
Now, a lot of times, people hear palliative care with
yeah,
hospice, which is end of life care. And there is definitely a link. However, it's a separate division of
Mhm.
medicine and with a certification and training and all the things. And I'm like, okay, I'm going to have a double mastectomy and reconstruction. I'm going to have 4 months of chemo and 5 weeks of radiation. There could be some symptoms here, some pain potentially. And so I wanted palliative care as part of my team. And so as I was interviewing oncologists,
Mhm.
I mean, it would like it ran the gamut from, oh, you don't need palliative care to, oh, Holly, you're over exaggerating, you're not dying.
Yeah.
Well, needless to say, I did not hire those oncologists because they
Yeah.
didn't understand the value of palliative care.
Yeah.
And I explained it to them. It was the oncologist who said, absolutely, palliative care is part of the program.
Yeah, that's so
I hired.
interesting because I hear all the time from a lot of our patients, oh my God, I just had a bone marrow biopsy and they didn't even, you know, give me anything for that.
Oh,
And
oh,
I was in so much pain, I couldn't stand it.
oh,
And now I'm so scared I have to have another one done in, 6 weeks or something, and I have to do it again.
yeah.
And I'm so frightened, what do I do? So that sort of thing, is often left to the doctors. They're just kind of, they do this every day. They're not thinking that, this is a
Mm-mm.
very scary, all these procedures. And so that's a really good recommendation for folks to also make sure that they have the right support around pain management and different sort of treatments that they're going to be facing.
Absolutely. For example, here's an example. I had a portacath, which is a instead of having the chemo go through the veins in my arm, it went through a device in my chest,
Mhm.
and it hurts to access that. It's called accessing it when you put the needle in,
Yeah.
and then the chemo goes through. I know you know. I don't know if everybody knows.
Yeah.
And so anyway, I wanted like something to lessen the pain. And the first time I didn't have anything. I was like, wait, what? No, this hurt. Ow. And
Yeah.
so, every time thereafter I had lidocaine on top.
Yeah.
It was like, it made it so much easier. And
We
so,
have somebody here that joined and said, so true. Yeah.
oh my gosh, it's just, and so those are the things,
Yeah.
when something's not right, it's so important to speak out about it, to
Mhm.
talk about it, because we as patients are very much a part of the
Yeah.
team here,
Yeah.
and decisions are not meant to be dictated to us. We are supposed to be a part of the decision making process.
Mhm. And can you speak a little bit about, your treatment and, kind of what you did or how you help other patients kind of manage the pain and the discomfort of chemotherapy? And, if they have any side effects from radiation and things like that, that are, obviously can be very, uncomfortable and make somebody very ill.
Yeah.
And we have that question all the time, like, what do I do with, I'm about to do another round of chemo, and my last round was so terrible. How do I deal with, another round?
Absolutely. Absolutely. And I was, wait, I think my chin coming down here. Hope this is all right. Um, and I would, so I had a double mastectomy and reconstruction, I mentioned, and 4 months of chemo and then 5 weeks of radiation. And I was, for whatever reason, the person who not only found every crack, I jumped through. I mean, it just seemed like every time I turned around, something else was going wrong, and it was really, really difficult. And I'll go back to the palliative care. The number of times that palliative care was involved in my overall
Mhm.
care was, I mean, it's so much of the time, whether it was pain and symptom management, like pain from the surgery. I had a real debacle when um, I asked for a particular type of pain medication after my surgery,
Mhm.
knowing that the traditional one didn't work. And I remember waking up literally glued to the ceiling, thinking that something is terribly, terribly wrong. And my best friend, with whom I went to nursing school, was sitting by my bedside. It was the middle of the night. And she ran over to the pain med machine, and she said, this can't be right, can't be right. Went to get the doctor, or I'm sorry, went to get the nurse. The nurse came in, she said, oh my God, they forgot to turn on the pain medicine. after my surgery. And it was a terrible mistake that then put into motion this whole recovery process before I even started chemo. And so things like this unfortunately happen, wherein mistakes happen and people are set back. And so the number one thing that I can recommend is that people ask for help, ask for help, and they ask for support. And every circumstance is different. Every patient's experience is unique. And so the best advice that I can give is to ask for help. And the other thing is a philosophy that I have, and that is that no is just a delay.
Mm-hmm.
In other words, if somebody says, well, there's nothing we can do, there's always something that can be done. There is always something that can be done. And so engaging with the healthcare team to really help facilitate whatever needs are being either unmet or whatever needs exist.
Yeah.
Engaging with the whole team, the nutritionist, the psychosocial team, the patient navigation, the Bone Marrow and Cancer Foundation has so many phenomenal services that are available to support people. And so asking for help.
Yeah. Really advocating for
Yeah.
yourself, because if you had not turn to your friend who was by your bedside. Thank God you had her as an advocate with you.
Yeah.
You know, you could have just thought, well, maybe I'm just crazy and
Mhm.
there's the pain is just what it is
Yeah.
and there's nothing I can do about it.
Yeah.
But instead you questioned it and she then saw that that was happening to you. So I know a lot of patients sometimes don't want to question the medical professionals, even if it is their right to do so, and they just get
Mhm.
nervous
Yeah.
in trying to navigate that and not get their healthcare, professionals angry at them.
Yeah.
And they fear that a lot of the time. And what can you say around that, being a nurse and then also being on the side of a patient side,
Yeah.
how you kind of navigate talking to your doctors or nurses or whoever is, with you on your team, and to kind of question what they're doing or ask questions.
Yeah, absolutely. And I think one way to do that, I mean, if somebody's in the hospital, for example, and we all know that healthcare teams, especially nurses and patient aides or LPNs, are overworked. I mean, it's just it's a factor, unfortunately, of our healthcare system today. And so by sort of having a bit of compassion
Mhm.
toward those who are caring for you, and some curiosity about what maybe they're going through, that can be really helpful. It's a bit of a dance, and it's a meeting in the middle. And when you're having a bad day and someone's kind to you and someone treats you with respect, you're going to be a lot more likely to partner with them, to
Mhm.
provide them with what they need. Speaking both from the nursing side as well as from the patient side,
Yeah.
and that actually really really helps.
Mhm. Right. Yeah, really, I suggest that to really, I mean, especially when you're in the hospital and during COVID, I had so many patients that were in the hospital and they were by themselves
Yeah.
and they only had the nursing staff really by their side the entire time.
Yeah.
And it was such a stressful period. And and the loved ones would want to go visit their patients,
Mhm.
their family members that were in the hospital, and they couldn't. They had, restrictions and this and that. And I always said, just try to make friends,
Mhm.
because the
Mhm.
the more you're gentle with that, you'll, try to get kind of what you want out of it.
Absolutely.
And yeah, so that's a very good suggestion.
Mm.
Um, and in terms of like how your life changed, how did you manage, or, and what do you tell your patients now, like how to manage being a patient and also trying to keep your own identity?
Oh, that's a great question, because when you're in it, it's all encompassing. No, it is absolutely all encompassing, and it sort of overtakes you. It feels a little like a tsunami wave where it really overtakes you, and it feels like your identity. And one of the ways that I got so bored with myself.
Mm-hmm.
I got so bored talking about myself or talking about it. It's like, so when I would have visits with friends, when I felt better, it was like, I thanks for asking about me. I don't want to talk about me. I want to hear about you. I really
Mm-hmm.
want to know what's happening with you. Tell me about life outside of
Mm-hmm.
this cancer bubble that I'm in. And that really provided a lifeline for me so much of the time, because it was, okay, I'm here now. And oh, I see Pat and Molly. Hi guys. Just joined. It was a lifeline to the outside
Mm-hmm.
world. And so it was also a great reminder of um, the fact that I was in this space for a period of time, and it was a period of time. It was a grueling, awful, long period of time, but it was a period of time. And so talking with people about what was happening in their lives, or, you know, People
Mm-hmm.
Magazine, or something like some such like that. It was very, it lightened. And one of the other things that when I would have visits with friends and loved ones, when they would ask, okay, where are you now today? Like, do you want to talk about what's going on with you, or do you not? Kind of like, where are you in this space today? Because there were times when I did want to talk about what was going on, and times when I really didn't.
Mm-hmm.
Yeah. So that was a way to also, keep some semblance of my identity outside of, cancer patient.
That's a really good suggestion as well, because also people don't know how to respond,
Mhm.
so by letting them know and having, kind of what you want to talk about is
Yeah.
also
Yeah.
a good, they can kind of follow in where you're at.
Yeah.
If you want to, be talk about your diagnosis or your treatment or your whatever side effects you're feeling, or just like, I don't want to talk about any of it. It's probably really good to be really clear with the people around you so they don't have to guess
Yes.
what might be okay to talk about.
Right.
Is that,
Absolutely.
yeah,
Because guessing it really doesn't work very
yeah,
well. It really doesn't work very well. So literally
yeah.
asking the person.
And yeah, not because so many people get offended by some of the things that their friends say,
Yeah.
when they're in treatment or when they're going through a cancer diagnosis. So people are so kind of fearful around where to step and where it's safe to go.
Yeah.
So I guess from a patient perspective, it's really good just to say, this is how I'm feeling,
Mhm.
let's talk about, you
Absolutely.
know, the weather, or, or
Yeah.
about myself. Yeah. So,
Right, right.
yeah.
And as along those lines, Christina, like literally as a person going to, be a support to somebody, just asking the question and saying, look, I'm kind of feeling a little awkward right
Yeah.
now. I'm not really sure which way to go.
Yeah.
Can you help me here? What's working for you today? Because I really want to give you what you need. And even if you don't know I mean, I had one girlfriend when I was in the bottomless pit of chemo despair, and she literally would put on her flannel snowman pajamas, and she climbed into bed with me and
Hmm.
held my hand, and we watched TV together, and we didn't talk.
Yeah.
And that was amazing. And
Yeah.
exactly what I needed.
Hmm. Yeah, that's great. So she had a good intuition on
Mhm.
kind of what you needed, but not obviously everybody has that, but that is to ask is probably the best way to go about that.
Absolutely.
And and speaking of kind of what our friends and how they help us, and to kind of turn this back to Cancer Buddy,
Mm.
and what we're trying to do with that app is to try to, garner a really incredible community of patients and caregivers and survivors that can, meet others and meet buddies that have gone through a similar experience or is going through a similar experience at the time, and to really get that support so they can relate and match up on all sorts of, diagnosis, age, gender, ethnicity, what hospital they're at. They could, so many people want to meet other patients. Was that kind of was, did you want to meet other
Oh,
people going through?
oh, Christina, when you first told me about Cancer Buddy, I mean, I just was elated because it didn't exist until
Mhm.
now. And I was so excited because I would have given anything to have had something like the Cancer Buddy, or to have had Cancer Buddy, because in the middle of the night when I was up on my with steroids and on roid rage and going through all this stuff, if I could have had somebody with whom I could have connected, there's this really bizarre and unique experience about being a patient, a person with cancer, and that is there's this feeling that you're isolated, like you're all alone. And even though, how many millions of people are diagnosed every year, but there's this feeling of being alone. And what Cancer Buddy does is it takes that away. Or, at the very minimum, it mitigates it, because you know that there's somebody else out there who's feeling what you're feeling, who's thinking what you're thinking. And
Mhm.
having that connection is just extraordinary. I mean, on the Cancer Buddy app, I've connected with people who are outside of treatment, who have been dealing for a long time with the collateral damage of treatment.
Mhm.
You don't finish treatment, and then all of a sudden everything's sort of
Yeah,
back to normal. If anything, it's the opposite. It's a
yeah,
creating of a new normal. But anyway, but
yeah,
connecting with people on the Cancer Buddy app in a way to be able to share the experience is just fantastic.
yeah. I've seen, um, over my years of experience as a social worker and trying to create a program where you're matching, patients to patients and survivors to survivors and caregivers to caregivers. It was so difficult. So I'm hoping that this app will be something that will really take off and, really grow a really strong community of support. Because as you say, it's like no matter what, even if you have people around you that are helping you and supporting you, you're still feeling lonely because you feel like you're the only one that's going through this, and they're living their lives as best they can, even if they're a caregiver. But they're because that can be very difficult, obviously, for a caregiver to be in it with a patient. But
I
it's
mean, like Cancer Buddy, it's I think about the you know people when they're not feeling well have a tendency, or even at the grocery
yeah,
store in live, to like scroll through social media, and when you see people outside of your circumstance who
yeah,
seem to be living this great and fantastic life, and you're just feeling awful,
yeah,
then to be able to go to a Cancer Buddy app to connect with people, I mean, oh my gosh,
yeah.
awesome,
So
so fabulous.
yeah, if anybody's on this Instagram and they need to, find a community, please, download it. It's in Android and on, iOS. So it's in both operating systems. But yeah, so that's a very important piece of resiliency, is to have the community and people kind of lifting you up and helping you stay positive. In terms of how you stay positive and how you kind of keep your patients that you work with to not, just fall apart, and to try to know that there's hope there and to stay strong during treatment. What are your, what do you tell them, or what are your suggestions?
Well, for me, when I first started, I mean, I had a great deal of perspective when I was first diagnosed, because I had been a hospice nurse.
Hmm.
So even though hearing the words "you have breast cancer" was awful, I knew that there were a lot of other things that I could hear from a surgeon that would have been worse. And so I had a great deal of perspective. And I remember my husband was actually out of town, out of town, poor guy, bless his heart, when I was diagnosed. And so I was with a very, very dear friend, and we were driving home. And I remember saying to her, I was like, well, I guess it was a silver lining that I was diagnosed with breast cancer instead of something else that could have been a lot worse. And she was like, well, that's one way to look at it. And then I found myself sort of looking for silver linings to every day. And I don't mean silver linings in this Pollyanna. I mean, people like boohoo silver linings, but for me, they were like the tiniest itty bitty little things that made all the difference in the world. And they provided balance and perspective to
Mhm.
really awful days and sometimes my darkest of moments. I remember one time I was literally in that bottomless pit of chemo despair, and I was laying on my bathroom floor after I'd been in the bathroom, and I couldn't get the 10 feet to my bed,
Mhm.
and I was laying there. I was like this bald skeleton, and I was just like, okay, Miss Silver Lining, where's your
Yeah.
silver lining now, because you can't get the 10 feet to your bed. And I no sooner had that thought than my 90-pound black lab named Buzz came walking in. I didn't call him. He just walked in and he curled up into a little ball next to me. And
Mhm.
then a few minutes later, my husband came in, and oh, this brings tears to my eyes still today.
Yeah.
And instead of like trying to pick me up,
Mhm.
he just sat down and he put my bald head in his lap and he rubbed it.
Yeah.
And and so then I'm laying there, I'm like, all right,
Yeah.
well, I guess there are my silver linings, and I didn't suddenly have the strength to walk to my bed. I just was
Yeah.
like in that moment. I was like, okay, you know what?
Yeah.
In the deepest and darkest of days of experiences, there are always silver linings,
Mhm.
and so that having balance and perspective, and call it whatever, call it whatever you want, but being able to look for just like something good, or days when I was so sick and I like couldn't go outside, and I would look and be like, oh, there's a little butterfly out my window. Oh
Mhm.
God, that's beautiful. That's beautiful. There's a little silver lining for me today. Thank you.
Mhm.
Thank you.
A lot of people talk about the silver lining to their cancer experience.
Yeah.
Um, and some people say, oh, that's, a bunch of, crap or whatever, have
Yeah.
no silver
Oh,
linings.
just
But,
look for the
but
silver
yeah,
lining and that everything's fine. Like,
but,
no, no, that's
but
not
people,
it.
good comes out of this horrible situation. If it's laying in your husband.
Hmm. Oh, I lost it. I can't hear you now. There you go. All right, now I got you. Yeah.
Sorry about that. I think that was a call coming in or something.
That's okay.
Um, and so talking about silver lining in your book, because you were inspired to write a book after your
Yeah.
experience. So maybe you can just talk about that for a minute.
Sure.
What inspired you to do that?
So I had started a blog as a way to, I'm going to just put this like back in here. Technology is a blessing and a curse here.
I know. Now I can't hear you.
Huh?
Well, there you are.
Okay.
There you are. Okay.
So I'd been writing a blog back in the days of blogs, to keep my family and friends apprised of what was happening with me. And I wrote it I found myself writing it from the perspective of the patient as well as the healthcare provider. Like, okay, here's what happened to me. Like I went to get my Portacat placed, and I, asked for the pain meds, and I, made sure I had a warm blanket, da da da. So I would like add all these tips
Yeah.
for people. And so the blog itself sort of went viral, and it evolved into this book, and it's the book that I wish I had when I was going through the experience. It was I was looking for something that was very practical, but also hopeful. I wanted
We
something
have
that,
somebody that just said the silver lining blog was my happy
oh,
place. You were always so generous. Really sweet.
sweet, thank you. And so it really evolved, and it became the book that I wish that I had. It didn't exist,
Hmm.
and so that's why I wrote it. And it unfortunately keeps going around because the diagnoses keep
Yeah.
happening. And so yeah, so it came, and it was so unexpected. But for me, the number one antidote to pain and suffering is is being of service.
Hmm.
And so to be able to help those who came after me, just as those who came before me my experience more bearable and more effective, it was the opportunity to do that, and that's sort of always been my ethos, is going to service.
Yeah. That's really amazing that you had the inspiration, but just to share, you want to share information because a lot of people don't realize. I mean, that's so important to help somebody that's newly diagnosed kind of avoid certain things or also just help themselves through somebody else's experience.
Yes,
And
exactly.
yeah,
Exactly.
so that's amazing that you did that. Um, and to kind of wrap up, and what would you tell like a newly diagnosed person how to kind of be resilient around their diagnosis and because even waiting for their first doctor's appointment after getting a diagnosis is so difficult. From just waiting for their first appointment, it could be several weeks out because doctors are so busy, and just trying to keep themselves calm during that time to their first, whatever is going to happen, either, surgery or chemotherapy or whatever their treatment course is going to be, and to try to keep people positive.
Well, I think, kind of a really important step between the diagnosis and then, making the plan after the healthcare team has been assembled is again, and I've said this multiple times, but asking for help. And I realized, I mean, unfortunately, it took a cancer diagnosis for me to realize this, that asking for help is a sign of strength, not weakness. And
Mm-hmm.
so I would encourage people to go to CancerBuddy app and sign on, because there are people who are in your exact same place who are going through the exact same thing. Connect with the Bone Marrow and Cancer Foundation. I mean, I'm such a huge fan, Christina, of all that the Bone Marrow and Cancer Foundation does, the CancerBuddy app. I mean, there's so much support available to people.
Mm-hmm.
So in that liminal space where it feels really, really scary and you don't know what's about to happen, that's when you can start harnessing the support,
Yeah.
to be able to help every step of the way. And that's the number one thing I would recommend.
Yeah, well, thank you. I mean, we have pride in our work at the foundation of really helping patients, and there's no call center. You always get a human being, and that wants to help, and be it navigating them through, to treatment centers, to resources, to financial assistance programs, to counseling, where you're very involved, and CancerBuddy, of course, and so we really try to do what we can to help families get through this very difficult time.
So
So
it's so important, and I just am so grateful to you and all of your colleagues for all that you do, because I mean, I've seen you in action, and oh my gosh, you're amazing.
you're sweet. You're sweet. And we appreciate you so much being involved in the organization and giving of yourself and your time to patients that turn to us for assistance. So thank you, Hollye. And
Absolutely.
thank you for being here tonight to
We made it. I
share
made it.
share your experience, which is, really help so many people get through their difficult times. And we'll just keep doing more work to help, those that need it. So,
Absolutely. Absolutely. Well, thank you for having
yes,
me.
well, thank you for being here, and thank
Absolutely.
to everybody that joined us tonight.
Yes.
And
Thank you all.
we appreciate it, and we'll see you soon.
Okay.
Okay,
Great. Thank you.
bye.
Bye.
Good night, everyone.